Hello, sir. How are you?
Good morning.
Please make yourself comfortable. So, today we're going to talk about gum problems. Here is a diagram of the healthy situation. What we call the periodontium consists of the supporting tissues of the tooth, the gum, the alveolar bone, the ligament, and the semen that covers the root. In the mouth, there are microorganisms, thousands of microbes that need to fasten on in order to develop. Within 24 hours, this creates a biofilm that we call dental plaque. Inside this plaque, the bacteria are 500 times more aggressive than when they are isolated, and the sole purpose of our brushing is therefore to disorganize this army. The place when these microorganisms like to hide is in the furrow, this groove between the tooth and the gum that we call the sulcus here. This dental plaque causes a reaction in the gum, gingivitis. The gum is red and swollen, it bleeds and may be painful. This inflammatory reaction is an alarm mechanism. We see that there is a problem and a defense mechanisms. The blood vessels carry natural defenses. So any bleeding should not make you fearful. On the contrary, it should encourage you to brush that place even more thoroughly. In a few days, this dental plaque can develop into tartar, which is significantly more tenacious. If we do a scaling on this stage, the process is reversible. The gum returns to its original state and there is no loss of bony tissue. However, if the tartar builds up into often and or if the patient is weaker, the gum can no longer play its defensive role and the microorganisms can penetrate more deeply into the sulcus and form what we call a periodontal pocket. Under the gum are the bony tissue and ligament that provide real support for the tooth, and these tissues are gradually destroyed by the advance of the tartar. The problem is that, to begin with, the swollen gum stays at the same level. We can't see the tartar, and the microorganisms become increasingly inaccessible to brushing. Brushing was already insufficient on the margin of the gum, otherwise the problem will never have started. Now it becomes impossible to brush effectively 5 mm beneath the gum, for example, so it's not surprising that this disease can progress. Not all patients are the same, some may be more vulnerable than others. The progression from gingivitis to periodontitis depends on two main factors. The type of bacteria. The bacterial flora differs between one patient and the next. The patient's defense system, which depends strongly on the patient's genetic makeup and environment, smoking, stress, and general health. To make the diagnosis, as well as X-rays, we use a periodontal probe. This is an instrument that allows us to measure the depth of the pockets around each of your teeth. The bad news is that any destroyed bone stays destroyed. The good news is that we can try to stop the disease at the stage when we are tackling the problem today. How do we do this? Well, by mechanically removing the bacteria through deep scaling and planing. This is the role of the professional. And by neutralizing on a daily basis the bacterial load on the surface of the gum. This is your role, naturally. So, let's take a moment to talk about this plaque control.